Hi, I'm Dr. Steve Knighton from Nottinghill Family Wellness Centre, and what we're going to go over here is treatment for our most common knee pains. So most knee pains are going to get an IFC machine to start with a heat pack for 8 to 10 minutes. If it's a hamstring injury, we might move the machine a little higher. If it's a medial meniscus, we might have something in here. Patellar injury will be a little different. Lateral be a different angle too. But about 8 to 10 minutes, sometimes 12 minutes with the IFCP machine and a heat pack, just to stimulate blood flow, loosen up tissue, and it really loosens up the knees, and most people with the knees are stiff. After we get the IFC and the heat done off the patient for 8 to 12 minutes, we go into a thing called Shockwave at the clinic. Shockwave is a pneumatic gun. There's a bolt in a tube, comes across and hits the head here, breaks up a lot of scar tissue. Patients love this, especially for knee pain, getting into the meniscus area. Quad injuries, people feel 20% different after the first visit. So as a bolt in a tube hits here, and we go in the areas of injury. So if it was a quad injury, we would run the gun and we would get it all through here. I'd run it all the way up, get it down, 8 to 1,200 hits. In the meniscus, we would come on the inside. I would work the meniscus over pretty hard, trying to find the place where the patient is the most pain, and we work from there. Patellar ligament, we come in here. A lot of our kids get this for overactivity. Patient with Osgood-Schlatter's and a big bump in here, love the Shockwave on here. And lateral knee pain would be the same thing for the meniscus. And then the IT band, we'd run all the way up the leg, from the hip, come all the way down. That's the Shockwave for this. Most patients in the knee, I'd say between 1,000 and 1,500 hits, only because it's a bigger muscle, especially stuff in the quads. When we get into the finer points in here in the meniscus, it's more what the patient can tolerate, but I would say a max of about 1,200 hits. And most patients, even with a big meniscus injury, will feel a difference after their first visit. The final thing we do for most knee complaints is a thing called Graston. So these big handlebar things, rip apart some of the scar tissue and work on the nodules. This is going to be a little bit more painful than the Shockwave, but patients notice a difference. And what I'm feeling for when I'm doing this is little nodules in the tissue, and then I really hit on those pretty hard. So the quad's a little different than the other muscles. So if it was a meniscus injury, I'd come in with a different unit and I would scrape in through the side here. Patellar ligament, I'd come in right like this, and then lateral in there. When it is the IT band, I would do the entire thing. I might bring the big handlebars out too and just work this, but most people, the most pain is right in the bottom here, and even on our model here today, I can feel that's pretty bad on her. So IT band, scrape through here with the Graston, down the lower knee, people with Osgood-Schlatter's, same thing, medial in here, the big handlebars to the quad area in there.